Ever experienced a headache so severe it feels like a hammer pounding in your brain? Today, we delve into the world of migraines, a neurological condition that's much more than just a bad headache. Migraines are a type of headache, but they're not your run-of-the-mill tension headaches. They're often described as an intense throbbing or pulsing sensation in one area of the head, accompanied by nausea, vomiting, and extreme sensitivity to light and sound. The pain can be so severe and debilitating that it interferes with your daily activities. But what sets migraines apart from other headaches is that they often come with what's known as aura. This can be anything from seeing flashing lights or zigzag patterns, feeling pins and needles, or even experiencing temporary loss of vision. It's a kind of warning system, a sign that a migraine is about to hit you full force. Now, you might think migraines are rare, but they're not. They're one of the most prevalent neurological conditions in the world. Globally, it's estimated that 1 in 7 people suffer from migraines. That's over 1 billion people worldwide. Migraines don't discriminate either. They can affect anyone, irrespective of age, gender, or ethnicity. And yet, despite their prevalence, migraines are still shrouded in a lot of mystery. There's no single cause that we can pinpoint, and the triggers can be as diverse as the people they affect. From hormonal changes to certain foods, stress, and even the weather, the list of potential triggers is extensive. But don't despair. While migraines can be daunting, they're not insurmountable. There are treatments available that can help manage the symptoms and even prevent migraines from happening in the first place. There's ongoing research too, so we're constantly learning more about this complex condition and how to combat it. Consider this your guide to understanding migraines, their causes, symptoms, and the treatments available. So, what exactly triggers these debilitating headaches? Well, the causes of migraines are as diverse as the people who experience them. It's like a unique fingerprint, different for every individual. Let's delve a little deeper into the most common causes, shall we? Firstly, we have hormonal changes. For some, migraines are an unwelcome guest that arrives with their monthly cycle. The fluctuation of hormones, particularly estrogen, can trigger migraines in many women. Then, there's the ever-present stress. It's a common trigger for many health issues, and migraines are no exception. High stress levels can cause a cascade of physiological responses that can set off a migraine. Let's talk about food and drinks. Yes, your favourite cheese or wine could be the culprit. Certain foods and drinks, including aged cheeses, alcohol, and foods with monosodium glutamate, MSG, have been known to trigger migraines. Sensory stimuli too can be triggers. Bright lights, sun glare, loud sounds, or even certain smells, yes, your favourite perfume might not be so friendly after all, can initiate a migraine. Sleep, that blissful escape, can also be a factor. Changes in your sleep pattern, whether it's jet lag or just staying up late binge-watching your favourite show, can trigger a migraine. And finally, medications. Certain medicines, especially those for heart disease and high blood pressure, can cause migraines. It's always important to discuss potential side effects with your healthcare provider. The list doesn't end here, though. Other factors like changes in weather, physical exertion, or even dehydration can also cause migraines. The causes are as varied as the people who experience them, and understanding your particular triggers can go a long way in managing your migraines. It's important to remember that while these triggers are common, they don't apply to everyone. What triggers a migraine in one person may not trigger it in another. The human body is a complex system, and migraines are a testament to that complexity. As varied as the triggers may be, they all lead to a similar painful experience. A migraine is not just a severe headache, it's a package of unpleasant symptoms. A package that often comes uninvited and stays longer than one would wish. First, let's talk about the most commonly known symptom, the headache. This isn't your regular tension headache. It's a throbbing or pulsing pain, often on one side of the head, that intensifies with physical activity. It's like a relentless drummer playing a beat inside your skull that just doesn't know when to stop. But migraines are not solitary creatures. They bring along a few uninvited guests. Nausea and vomiting are frequent companions. You may feel a sickening wave of nausea, sometimes followed by vomiting. It's as if your body is protesting against the relentless pain. Then there's the sensitivity to light and sound. Bright lights, loud noises, even certain smells can become unbearable. You may find yourself seeking refuge in a dark, quiet room, away from the sensory overload. It's a retreat into a cocoon of quiet and darkness, a desperate attempt to escape the bombardment of stimuli. But the symptoms aren't all physical. Migraines also manifest themselves visually. You might experience visual disturbances known as auras. These can be flashes of light, blind spots, or even zigzag patterns in your field of vision. They're like warning sirens, alerting you to the approaching storm of pain. And speaking of warnings, migraines often come with a heads up, a phenomenon known as prodrome. You might feel unusually tired, moody, or just off a day or two before the migraine hits. It's as if your body is sending you a memo. Brace yourself, a migraine is on the way. In essence, migraines are more than just headaches. They're a complex web of symptoms that affect not only your head, but your entire body, and even your vision. It's a full-body experience, and not one that anyone would willingly choose. Recognizing these symptoms can help you prepare for the incoming migraine attack. So, pay attention to these signs and arm yourself with knowledge. After all, forewarned is forearmed. While migraines can be extremely painful, the good news is there are ways to manage them. A variety of treatment options are available, and what works best for you may depend on the severity and frequency of your migraines, as well as your overall health. Over-the-counter painkillers such as ibuprofen or naproxen can be effective for mild to moderate migraines. For more severe migraines, prescription medications may be necessary. These can range from triptans, which can help to stop a migraine in its tracks, to preventative medications like beta blockers or antidepressants, which aim to reduce the frequency and severity of migraines. But treatment doesn't stop at medications. Lifestyle changes can also play a key role in managing migraines. Regular exercise, for instance, can help to reduce tension and improve overall well-being. This doesn't have to mean hitting the gym every day. A brisk walk or a gentle yoga session can be just as beneficial. Getting adequate sleep is also crucial. A lack of sleep or an irregular sleep pattern can trigger migraines in some people. It's important to aim for 7 to 9 hours of sleep each night, and to try to go to bed and wake up at the same time each day. A balanced diet can also make a difference. Certain foods and drinks, such as aged cheese, alcohol, and caffeine, can trigger migraines in some people. Keeping a food diary can help you to identify any potential triggers. Of course, every individual is unique, and what works for one person might not work for another. That's where alternative therapies come into play. Acupuncture, for instance, has been shown in some studies to help reduce the frequency of migraines. Biofeedback, a technique that helps you to control your body's responses to stress or pain, can also be beneficial. Finding the right treatment is a process of trial and error, but with patience, most people can find relief. Remember, it's important to work with your healthcare provider to develop a treatment plan that works for you. Don't lose hope. Relief from migraines is possible. So, let's recap what we've learned about migraines. Migraines, as we've discovered, are far more than just your run-of-the-mill headaches. They are a neurological disorder characterized by intense and debilitating head pain, often accompanied by other symptoms such as nausea, vomiting, and sensitivity to light and sound. Each episode can last from a few hours to several days, significantly impacting the quality of life of those affected. When it comes to the causes of migraines, it's a bit of a complex puzzle. There's no single culprit, but rather a combination of genetic and environmental factors. Changes in brain chemicals and nerve signals play a significant role. Certain triggers like stress, certain foods, lack of sleep, and hormonal changes can also spark a migraine attack. Speaking of symptoms, they're not limited to just head pain. Migraines often come with warning signs or a prodrome phase, where you might experience changes in mood, cravings, or even visual disturbances known as aura. The actual migraine attack is then followed by a postdrome phase, a sort of migraine hangover where you might feel drained and washed out. Now, onto treatment options. Migraines can't be cured, but they can be managed. Lifestyle modifications are the first line of defense, including regular sleep, balanced diet, stress management, and avoidance of known triggers. Medications are also available, both to relieve symptoms during an attack and to prevent future ones. These range from over-the-counter pain relievers to prescription drugs. In some cases, non-drug therapies like biofeedback, cognitive behavioral therapy, and acupuncture may also be beneficial. Remember, if you or someone you know is suffering from migraines, it's important to seek professional medical advice. Let's fight migraines together. one step at a time.